Welcome. I'm Stephen de Graaff and I'm currently Chairman of the Australasian Faculty of Rehabilitation Medicine Education Committee. I encourage your interest in training to become a rehabilitation physician. It is a dynamic and gratifying specialty which is leading the way in advocating for and supporting individuals with disabilities. The faculty training program is based on the principles of adult learning. We anticipate our trainees will become competent, self-directed, lifelong learners, developing the necessary skills in self-assessment, information management and problem solving. There are criteria for entry into the training program. Firstly, you need to have a medical degree for the purpose of medical registration in Australia or New Zealand. Secondly, you must have completed at least 2 years postgraduate supervised training in general medical and surgical areas and developed a satisfactory level of clinical competence in medicine. This knowledge and these skills are evaluated in the first year of vocational training through the satisfactory completion of 2 compulsory assessment modules, one in clinical medicine, surgery and basic sciences, and the other in clinical examination skills. Vocational training comprises 4 years of clinical experience in an approved rehabilitation program. The program is divided up into 6-month accredited training terms with an accredited supervisor overseeing the term. Formative assessment is based on satisfactory written reports from the supervisor in each 6-month training term. Training coordinators are appointed to each state and New Zealand to facilitate the faculty's training objectives at the state level. The training terms encompass specific rehabilitation competencies including neurological, acquired brain injury, spinal, orthopaedic, multi-trauma, cardiac, respiratory, musculoskeletal and amputee rehabilitation. Pain management, occupational rehabilitation and medico-legal issues are also addressed. Paediatric rehabilitation training is also available. Other assessment requirements include completion of special external modules including behavioural sciences, clinical research, administration and management of rehabilitation services, and clinical neuropsychology. These need to be completed prior to sitting the final fellowship examination. During vocational training, trainees undertake 12 in-training long case assessments, an average of 2 in-training long case assessments per 6-month rotation. The trainee is also expected to complete 2 formal long case assessments prior to the completion of fellowship requirements. Formative evaluation for trainee involves setting up learning objectives at the start of the term and reviewing these at the 2nd, 4th and ultimately 6th-month mark of the term. Areas reviewed include patient care, development of a rehabilitation plan, patient management and communication skills, as well as self-directed learning. The ultimate assessment is the fellowship exam. This has written and clinical components. The written exam comprises of 2 papers, Paper A, short answer questions, and Paper B, multi-choice questions. The clinical examination's objective is to examine the candidate's competency in assessment and management of disability. The clinical examination takes the form of a standardised clinical examination. This involves a series of stations through which the candidates move at timed intervals, with each station providing a different clinical problem or task. This format allows the standardisation of the tasks and control of examination content. Once you successfully complete the requirements, you will be awarded Fellowship of the Australasian Faculty of Rehabilitation Medicine, FA-FRM, a principal specialty, and you will be recognised as a consultant physician in rehabilitation medicine. Once again, welcome, and if you are interested in learning more about our training program, please contact our Sydney office on 02 8247 6216.